All right, so, you guys send us some really interesting stuff. And this one that came in from Unilad, this
Mhm.
one really caught our eye. So
For sure.
we thought we'd do a deep dive on it today. And it's all about this possible link they're talking about between uh, something pretty common that a lot of people do and an increased risk of prostate cancer.
Yeah, exactly. We've got this article here, and it's reporting on some new research that just came out. And I guess our goal here is to really sort of dig into it, beyond just the headline and see what the connection is, what the science is saying about it and what it might mean for, men's health.
Absolutely. So the headline here is pretty straightforward. It says new research points to a 45% increased risk of dying from prostate cancer in men who share this common habit. And that's a pretty big number.
Yeah, no kidding.
It definitely makes you pay attention. So
Mhm.
before we even get into the why and the details of the study itself,
Mhm.
what is this common habit that the article's talking about?
Well, it looks like the habit they're talking about here is basically skipping out on those regular prostate cancer screenings. So essentially, it's men who aren't going to those checkups like they're supposed to.
Yeah, and to be honest, that's something that probably a lot of us can relate to. Like we all put off those health appointments for, whatever reason.
Mhm.
So for anyone listening who might not be, super familiar with this, can we just take a step back and talk about prostate cancer itself for a second? Like why is this whole screening thing even a big deal?
Oh, for sure. So prostate cancer is a really serious issue for men. In the U.S., it's actually the second leading cause of cancer deaths for men. And the American Cancer Society says that about 1 in 8 men are going to be diagnosed with it at some point in their lives. And sadly, about 1 in 44 men will end up dying from it.
Hmm.
But, and this is super important to remember, most men who are diagnosed with prostate cancer don't actually die from it. Early detection is key here. You know,
Yeah.
Right. That's a really good point to emphasize. It's not about freaking out. It's about knowing your risks and catching things early. So this 45% figure comes from a pretty major study that the article mentions. What can you tell us about this research?
so this all goes back to this huge study called the European Randomized Study of Screening for Prostate Cancer. ERSPC, they call it. It's the
Yep.
biggest study ever done on prostate cancer screening. They've been running it for like 20 years, and it involves data from 7 different countries all over Europe. So it's pretty comprehensive.
Wow, 20 years. That's a crazy amount of data. And the article mentions that the findings from this ERSPC study, I know they have some implications for how countries might approach prostate cancer screening, and they specifically talk about using the PSA test.
Right. The data from the ERSPC is basically saying that having these national programs that use the PSA test to screen men could really help with catching prostate cancer earlier. And when you catch it early, you have a much better chance of treating it successfully and having a good outcome.
Yeah.
Plus, you might be able to avoid some of those more aggressive and expensive treatments down the road.
So the idea is basically find it early, treat it better, maybe less intense treatment later on. The article even gives us a specific number for how effective PSA screenings can be.
Yeah, they do. The evidence shows pretty consistently that regular PSA screenings can reduce the risk of dying from prostate cancer by about 20%, which is pretty significant when you think about it.
20% reduction in the risk of death just from getting those regular checks. Okay, so we've got that 20% reduction on one hand. And then this new research is saying there's a pretty big difference for those who aren't getting screened. So let's get into that. What exactly did this new analysis of the ERSPC data find out about the guys who are skipping their screenings?
All right, so this new analysis was done by some researchers over at the Erasmus MC Cancer Institute in the Netherlands, and they looked at a group of 72,460 men. And get this, about 1 in 6 of those men were classified as non-attenders. Basically, they just weren't showing up for any of their scheduled screenings.
And that's where that 45% increased risk number comes in, right?
Exactly. That's what they found. The non-attenders, the guys who weren't getting screened, had a 45% higher risk of dying from prostate cancer compared to the guys who were going to their screenings regularly.
45%. That's a massive difference. And the article also mentions another number. It says a 39% higher risk for non-attenders. Is that just a different way of looking at the same data, maybe comparing it to a different group?
It sounds like the article might be talking about a slightly different comparison there.
Yeah.
It's pretty normal in research to look at the data in different ways to get the full picture. So the 45% is specifically comparing non-attenders to attenders, but that 39% might be comparing different groups within the non-attenders themselves, or maybe it's from a slightly different statistical model. It's hard to say for sure without seeing the whole study, but the main message is still super clear. Skipping screenings is way riskier than going to them.
Okay, so even if those percentages are a little different, the bottom line is the same. Avoiding screenings is a much bigger risk. So on the other side of things, what happened to the men who were actually going to their appointment?
Well, the study found that the guys who were getting screened had a 23% lower risk of dying from prostate cancer. So you see this clear split. Screenings mean lower risk. Avoiding them means much higher risk. It's pretty stark.
It really shows you how important those checkups can be. So the lead author of the study, Dr. Renee Leanan, she had an interesting take on why these non-attenders might be facing a higher risk. What was her thinking?
She actually used the term care avoiders, which I think is really interesting. Her theory is that men who don't go to their prostate cancer screenings might also be less likely to take care of their health in other ways, too. Maybe they don't exercise as much or eat as healthy or go to the doctor for other things. It's kind of the opposite of people who are really proactive about their health and make sure to get those screenings.
That makes a lot of sense. It's probably not just about this one appointment, but more about their overall approach to health and prevention. And Dr. Leanan also had a message for healthcare professionals too, right?
Yeah, she said it's really important for doctors and nurses and everyone to understand why men aren't going to these screenings. If they can figure out those reasons, they can come up with better ways to get more men to participate in prostate cancer screening programs, make them more effective. So ultimately, she's saying that getting more men to those appointments could be a game changer for national screening programs.
So it's all about figuring out what's stopping them and what might motivate them to go, and hopefully that'll save some lives. The article also mentioned where these findings are going to be presented to the rest of the medical community.
Yep, they're going to be presented at the European Association of Urology Congress, the EAU Congress in Madrid, Spain. So the medical community is definitely paying attention to these results, and they'll be talking about what they mean for how they treat patients and what kind of policies they put in place.
And last but not least, the article included a really helpful resource for anyone listening who might be thinking about all of this.
Oh, yeah, it did. It gave the contact info for the American Cancer Society. They got a phone number and info about their live chat service, which is available 24/7. So if anyone wants to talk to someone confidentially, they can reach out to them anytime.
Definitely good to know. So as we wrap up this deep dive, what would you say is the biggest takeaway here for you and for our listeners?
I think the biggest thing is that this research shows a really strong connection between going to those regular prostate cancer screenings and having a lower risk of dying from the disease. And on the flip side, avoiding those screenings means you're at a much higher risk. And we're not talking about a small difference here. That 45% increased risk for the guys who aren't going compared to the guys who are, it's huge. And it's based on a really big study that's been going on for years. So it really tells you how important those regular checkups can be.
Yeah, and thinking about this data, it makes you wonder about the bigger picture here. What are some of the things in society and in people's personal lives that might make them decide to get those screenings or avoid them? It's obviously more complicated than just making an appointment, right?
Oh, absolutely. It goes way deeper than that. It's about how well people understand health information, how easy it is for them to access healthcare, what they believe in personally, what their fears are, what they prioritize in their life. It's all connected. If we really want to improve men's health in the long run, we need to understand all these things. What makes someone say, okay, I'm going to go get that screening? And what's standing in the way for the guys who aren't going? Those are the big questions that this research is raising.
That's a great point. Some really important things to think about. So
Yeah.
that's about all the time we have for today, but
Okay.
thanks for taking this deep dive with us.
It was my pleasure.
We'll catch you next time.
Sounds good.